afternoon, everyone. Thank you very much for joining our BCSS TENA webinar today. My name is Maeve Fogarty and I am the Healthcare Development Manager with Bunzl Cleaning and Safety Supplies. I look after all the TENA range of products for the Republic of Ireland. Also on the call with me today, I'm delighted to announce we have two members of the ST team. They are Ian Daniels, who is the Account Sales Executive, who we work very closely with in managing the distribution of TENA in Ireland. And also our main presenter today is Leslie Turner. Leslie is a clinical consultant with ST and has been in this particular role for over 10 years. So I'm delighted to have them both on the call. At this point, I would like to extend a very warm welcome to all of you who have taken time out of your busy schedule to attend today's event. And also for any of you who have been on previous events, a big welcome back. So without further ado, I would like to hand over to Ian Daniels. Thank you, Ian.
I am the Account Sales Executive at ST. I work in a team called Care for Business, so I'd like to welcome you all today. Absolutely fantastic that you've all joined us. It's absolutely our pleasure to be invited back to participate in this collaborative event. We work very closely with Maeve, Anya and the team at BCSS. So it's an absolute pleasure to be back with you all today. I'm absolutely delighted to be joined by one of my clinical consultant colleagues, Leslie Turner. Leslie's got absolutely fantastic experience of working with the TENA brand. It's absolutely fantastic to work with her, and she's going to give what I hope is a very informative presentation to you all today. What I'm going to actually do now is going to show you an intro, which is for one of our patients, a gentleman called Jamie Gain, who we work very closely with at TENA. Really proud to be associated with Jamie, and we're going to share a video where he's going to give an introduction, and then after the video I'm going to share with you a link and pass over to my colleague Leslie, who's going to go through today's presentation. So thank you so much again for joining us. Great that you're all here and very much looking forward to the session. Thank you.
Hi there, I'm Jamie Gain. I'm a 27-year-old adaptive athlete and maths teacher from the south of England. I also suffer with double incontinence as a result of a spinal cord injury when I was about 16 years old. When I first started looking at incontinence and started looking up on the websites, I realized that actually it's predominantly older women that are portrayed as having incontinence issues. I didn't see any younger men. I didn't see anybody my age. I didn't see other men. And I thought maybe I'm the only guy who's suffering with it. But after more kind of communication with specialists and looking up more things online, I realized I'm not the only guy. I'm not the only young man. I'm not the only man who suffers with incontinence issues. And as part of my platform, I like to be able to share my story and to be able to show others that everybody suffers with incontinence issues. Doesn't matter what age you are, doesn't matter what gender you are, everybody has the opportunity to have incontinence troubles. So actually talking to specialists and being able to have a training session like this today is so important. Being able to get out there that everybody suffers with incontinence issues, everybody has the opportunity to access services, to access communication and be able to access those support. So thank you very much for your participation in today's session, and I hope you have a fantastic day.
Hi everyone, it's Leslie here, and as you've heard, I've worked with ST now for over 10 years. I'm a clinical consultant, and I'm thrilled to be asked to present to you today. Just to give you a little bit of background about Jamie and the reason why we asked him to provide us with that lovely little video. We met Jamie approximately 4 years ago. As a patient, we were asked to do a home visit to him because at the time he was really struggling with double incontinence and finding the right help to try and manage those solutions for him. When we came across Jamie, he came to us as a strong-minded individual. He was very inspirational. He leads an extremely active quality of life, and he wanted solutions to be able to continue with his active quality of life, but also he wanted to be able to reassure others that there was help out there. And so once we'd found solutions to his problems, we actually asked him if he would be prepared to collaborate with us to raise awareness of male incontinence and also to reassure men and boys that at the end of the day, whatever your problems are, with the right help, anything is possible. So what I'd like to do now is just present to you. So I will go off camera very shortly and get the presentation up on the screen. So the presentation for this afternoon then is identifying and managing male incontinence. And just to give you a few facts, urinary incontinence is a global problem. It's one of our greatest public health disorders. It is a global problem and it affects around 400 million people. Due to an ageing population, the problem with urinary incontinence is expected to grow, and we are seeing the figures growing rapidly on a month-by-month basis. And to be honest with you, the information I give you today will probably be very different in a month's time, especially with the impact of COVID and the pandemic. It is underreported, it is very much underdiagnosed and undertreated. It is a problem that predominantly increases with age. However, as Jamie says, it can affect anybody at any age. And sometimes just relatively simple measures can reduce the cost of incontinence, but also the cost of impact on lives in general. So with regards to prevalence in the UK, again, as I said, the numbers are changing rapidly. It is estimated around 14 million adults in the UK suffer with bladder and 6.5 million adults suffer with bowel problems. And that's not including the numbers that can have a combination of both. It is embarrassing, socially unacceptable, and it does affect self-esteem and morale, and also quality of life, which is really important when taking into consideration the continence assessments that are performed. We want to look at it in a holistic approach. Women can take up to 10 years before seeking help, but unfortunately men can take a much longer time to do this. And the figures around adults are 1 in 4 men and 1 in 3 women. And as I mentioned or touched on the COVID pandemic, we've seen huge rises on services, continence services, where patients are being discharged from hospitals still with symptoms of COVID to actually recuperate and recover at home. And some of these patients would never have normally suffered with incontinence issues. And again, this is affecting all different ages. The International Continence Society defines urinary incontinence as the complaint of any involuntary leakage of urine. This definition is not enough on its own. Each person's individual circumstances also need to be described, and this includes which type of urinary incontinence, such as the 4 main types, and these are, according to the International Continence Society, stress urinary incontinence, which is the complaint of an involuntary leakage on effort or exertion, sneezing or coughing. Urge urinary incontinence, which is an involuntary leakage accompanied by or immediately preceded by urgency. Mixed urinary incontinence, and this is the complaint of involuntary leakage associated with urgency and also with exertion or effort, sneezing or coughing once again. And then urinary retention often occurs when the bladder can't empty fully, and it is filled with a residual amount of urine, which in itself is a nice warm breeding ground for bugs and regular recurrent UTIs. This could also lead to dribbling and an overactive bladder issue and a bladder that has low compliance to elasticity. So how often? Frequency. So besides knowing what type of urinary incontinence an individual has, it's also important to know how often the individual experiences urinary leakage. It could be something that rarely happens, like once a month, or it could be every day, or even just several times a day, but it also could be a problem with constant dribbling. And then how much leakage and when did it occur? And all this information is really important when trying to decide the best solution for the individual. So for some, it could be just a few drops leaking, and for others, it could be the whole bladder emptying completely, such as reflex incontinence. And it's also important to find out in what situations the leakages occur. and this gives an indication of what type of urinary incontinence the individual has. For example, leaking when exercising indicates stress urinary incontinence, so that's a problem with the pelvic floor muscles. And again, with just the right information and support, sometimes that can be resolved. Having problems with urgency feelings and getting to the toilet in time indicates an urge urinary incontinence issue. And then what is the impact on the quality of life? And again, we cannot impress enough about how important it is to try and maintain a good quality of life for everyone. And urinary incontinence shouldn't prevent that either. And quality of life is such an important factor in this condition. Some people with urinary incontinence, regardless of the cause, tend to have more falls, especially elderly or frail. They may use more medication and have a larger number of other health-related problems and disorders. These people also have a greater need of help in daily life, and they also might have a reduced mobility which affects toilet visits, or just the fact that they are frail or infirm and struggle to get to the toilet on time. This dependency is an important factor for a reduced quality of life, and urinary incontinence may also disturb sleep, which then further impairs daily function. And then there's also the issue of social stigma. For most people, urinary incontinence is about a personal hygiene and self-esteem problem that it is difficult to talk about, and we know this. For some patients that come to us, they really do struggle to talk about these issues. Many will experience a constant fear of odours and leaks and embarrassment in using and disposing of incontinence aids if that's what they're using to manage the incontinence issue. But they may also experience a dependency on being near a toilet, and this can limit where they go and when they go out, planning days with friends and family, and just general socialising. For one to remain continent, an individual needs to recognise the need to void, so they need to have the signals there in place. They need to identify the correct place to go to the toilet and to be able to reach the toilet effectively and safely. They also need to hold on until they get to the toilet and be able to pass urine once they get there. So when we talk about a continence assessment for any individual, it's got to be, as I said before, a holistic approach, and that includes what a healthy diet and fluid intake is. And we all know it should be that we take at least 5 portions of fruit and vegetables a day, and for some people this is really difficult to do. We also need to ensure that we're looking at the types of foods we're eating and not having foods that are too loaded with fat, sugar and salt, because again, this will have a detrimental effect on a healthy diet, a healthy well-being. And also, we need to aim to be drinking plenty of good, healthy fluids. Not only fibre is essential, but lots of fluids to keep hydrated as well. And when we talk about correct fluids, I mean, we all like to indulge in our sugary carbonated drinks, our coffees, our teas, our alcohol. And why shouldn't we? After all, it's part of a quality of life, a good fun life. But what we can do, just by making small changes, they can have a real positive impact on how your bladder reacts. Drinks such as fizzy drinks, citrus juice drinks, they all have citric acid in, and citric acid has a detrimental effect on a bladder. They are very irritant. So just by changing some of those or having them within moderation can make a big difference. And drinks like tea and coffee, because they have caffeine in, caffeine is a big irritant to the bladder. So by making slight switches to decaf, again, can have a real positive effect on the bladder and how that bladder works. And what we like to do is encourage people to drink and make it important that they understand the right fluids to drink. At least 1.5 litres a day is a minimum for us to function well. And when I say function well, I'm talking about maintaining a healthy brain, bladder, kidneys and bowel. Essential hydration, especially for those living with dementia or dementia-related symptoms, as being dehydrated, and these individuals can then have their problems exacerbated. It can cause sluggishness, poor sleep patterns, constipation. By making a few changes to the types of drinks we normally consume can improve and make a difference to the incontinence issues, less irritant to the bladder. Essity worked in conjunction with the Nursing Times to actually put together a best practice identifying and managing male continence problems. And we put this document together with collaboration of the Nursing Times to lift the lid and help to raise awareness of male incontinence issues from boys to men. This was also to support healthcare professionals and nurses for caring men with continence problems and within the continence arena, and to encourage research into this area also. And for the best practice document in summary, it was recognised the need to understand the male experience of incontinence. And for many, many years, men never actually sought help. They felt it was a female issue. Men never became incontinent. It was always down to the women. However, times and thought processes have changed over the last 10 years. Unfortunately, we are seeing a much more aware male populace, but also the fact that we have celebrities that have had prostate issues in the past that are willing to share experiences. And compared to female incontinence, the male incontinence did receive very little attention, but we're actually changing that now. The best practice document comprises of a series of articles, which again are really worth reading, but also used as a resource. So part one is why incontinence is a hidden problem in men and boys. And again, the reluctance to actually share information and seek help, that has been one of the reasons for the hidden problem. What good continence care should look like for men and boys, and what nurses can do to improve to make male continence care a lot more acceptable. So with any gentleman or boy that approaches you or comes to a clinic with male incontinence issues, so the same types that we have with females, we can have a solution for them in the TENA Men product range. And the range we have ranges from a protective shield, so this works in the same way as the pant liner for ladies, and we have levels 1, 2, 3 and 4, and we have what we call premium fit and active fit underwear for gents as well. So the TENA Men protective shield, as I said, works in the same way as a lady's pant liner. It's anatomically shaped for the male anatomy to maximise leakage prevention. It's black in colour, so it's ideal for dark underwear. All TENA Men come singularly wrapped to support discretion and for an active lifestyle. And this is great, especially for boys who are at school, college or university, or even at work, who suffer with a light incontinence issue. And we're talking about a very light incontinence issue here for the protective shield. So for someone who has a slight dribble, because each of the TENA Men protective shield and its singular pack means that they can change these discreetly in the toilets and nobody knows that they're using them. They all contain odour control to allow for discretion and hygiene, and they fit securely and close fitting underwear, but they are close fitting to avoid leakage or movement. And then the TENA Men range, which continues from the pant liner, so levels 1, 2 and 3. Again, they're all anatomically shaped to fit the male anatomy and to maximise leakage prevention. Again, they contain odour control, which allows for hygiene and discretion, and they fit nice and securely in snug fitting underwear. And when we talk about suitable underwear, we're talking about fitted briefs or the nice close fitting boxers. And then we have the two additions, which are the Premium Men Fit Level 4 pants. These are a breathable item and they're designed just like regular underwear. They are all breathable and they have a flexible fit to stay in place. They have a dual absorbent lock core, and again, they contain the odour control for extra confidence. All our products are dermatologically tested, so they're kind for skin health. And then we've got the TENA Men Active Fit Pants, which are navy blue in colour, again for discretion, and they're a masculine cut. Again, contain the odour control for extra confidence and the secure absorption zone to lock in leaks efficiently and effectively. And then for those gentlemen who present with moderate to heavy incontinence, and this would be established once you've completed a robust continence assessment. And it's for those that experience moderate to heavy incontinence, those with limited mobility or mobility issues. They may be nursed in bed, they may spend their days in a wheelchair. It may be for those gentlemen with complex needs and boys as well. And for those who are less independent and may require full assistance. So we've got the Comfort range, and the Comfort range comes in a number of absorbencies ranging from 450 mils through to 1300 mils, and they're part of a two-piece system. And the absorbencies will depend on your local policy. And the TENA Comfort, the features and benefits, as with all TENA products, are breathable, and they all contain odour control. As I said, they're fully breathable with fast acting and highly absorbent cores that help preserve skin integrity and keep good skin health. They are ideally suited to wear with our premium fixation. However, providing your individual has suitable snug fitting underwear, if it makes them feel good about themselves, then let them use their own underwear with the TENA Comfort in place. There are wetness indicators on the moderate to heavy absorbency products to allow for the product to be changed at the right time and to avoid over or unnecessary changing. And they have the unique bowl shape as well that provides leakage security. And I talked about the TENA Premium Fix to actually use with the TENA Comfort. They come in a range of sizes from extra small through to 3XL. And the numbers of pairs and sizes, again, that would be provided are guided by your local policy. Premium are like a cycle short or a boxer, and they're to be used in conjunction with the TENA Comfort range to create the two-piece system, as I mentioned earlier. There is an area in the waistband at the back to write the person's name or room number should it be an individual that lives in a care setting. There are no side seams, so they're a seamless product, so there's no risk of any marking on the skin. And these fixation can be washed and dried at 60 degrees up to 50 times. They are styled like a short, but when we ask them to be worn, we encourage the actual leg cuffs to be brought up into the groins for added stability of the product. We then have the TENA Slip range, which is an all-in-one product. It's a body-worn product, so it's essential that the right hip size is chosen for the individual. And there's a range of absorbencies and sizes. They start at extra small and they go up to an extra large. And the absorbency ranges, depending on the sizes, will be 600 mils to 1850 mils. And again, we have the various absorbencies starting at Plus, Super, Maxi and Ultima. TENA Slip, as I said, is an all-in-one product, and it's got adjustable extra wide hook and loop tapes to ensure a secure fit. All the moderate to heavy incontinence products have the field dry advanced layer that keep the skin nice and dry and wick away the liquid from the surface as quickly as possible. The wetness indicators again allow for the product to be changed at the right time, and they are fully breathable and highly absorbent to preserve skin integrity. We then have the TENA Flex range, and the TENA Flex range is classed as what we say a modern product. It is a belted product, and again, it's a measured item. So it's really essential that you measure the individual's hip size and then choose the size accordingly. The working absorbency starts at 400 mils and it goes up to 2000 mils. So that's a large absorbency. So for someone who is very heavily incontinent would be ideal for this product. We have the normal, plus, super and maxi absorbencies, and again the absorbency will depend on the size chosen, but also availability of absorbencies will be dependent on your local policies. This is a standalone product, and again it's fully breathable. It's got a soft, elastic, comfy stretch waistband which ensures a secure and comfortable fit. Again, it's got the advanced Feel Dry layer that will quickly wick away any moisture on its surface, keeping the skin clean and dry. Just to remind you that all the TENA products in the range are latex free. We've got wetness indicators again that allow for the product to be changed at the right time, but it just enables better use of the product, not only for the individual, but for the carer as well. And then we have the TENA Pants. TENA Pants is great, it's ideal for anybody to use. We have a range of absorbencies starting at 300 mils through to 1050 mils, and again it's size dependent. So it is essential, because this is a very snug fitting item, that you get the correct hip size. And these are ideal to maintain independence, and also for those with dementia or dementia-related symptoms, because they are very much like a piece of underwear, it just causes less confusion to them and keeps them independent in using the toilet longer. You've got the Feel Dry Advanced layer, which again quickly draws the liquid away, keeping the skin clean and dry. They do, as I said, look just like normal underwear, which reduces the social physiological impact. But this, as I said, will depend on the level of absorbency required and the type of incontinence your individual has. Again, it has the wetness indicator and is fully breathable, but it is very much a snug fitting item. And then finally, points to remember. Urinary incontinence and the quality of life. It is so important that we encourage our boys and our men to talk about this, because just by us as healthcare professionals, we can actively help if they ask us, but also if we ask the right questions. We want to encourage openness to help erase the stigma. And there's lots of ways of improving quality of life for somebody with urinary incontinence. And we know it's difficult and has been very difficult over the years for men, because they feel it's a reluctance to talk to the right people. But by doing this and try to manage the incontinence themselves has not always proved successful. We have seen there's been a lot more publicised about male incontinence, and the more we do it, the better we'll be able to manage their problems for them, because what we want to do at the end of the day is ensure that their quality of life is unaffected. Thank you for listening, and now I'm going to hand over to Ian for any questions.
Oh, thank you so much, Leslie. I think everyone will agree with me what a fantastic and informative presentation that was. You are one of 3 clinical consultant colleagues I work with at Essity, and it's just fantastic the knowledge and expertise you have. So thank you so much for sharing that with us today. That was absolutely brilliant. A little bit conscious of time, however, we still have had a few questions through. So I'm just going to quickly go through a couple of the questions, and if Leslie, if you'd be so kind to potentially answer those, that would be great. And then we'll yeah, oh, bless you, thank you. And then we'll just look to sign off the session. But absolutely fantastic, and just so informative. And you know, at Essity, we're so proud to be challenging the perception stigma of incontinence. And I think with Jamie's introduction and that fantastic presentation, it really sort of reflects that. So thank you again. The first question I had through, which was really interesting, was somebody's asked me kindly, is there any websites or anywhere that people or colleagues or consultants can look for extra support, Leslie, at all, or is there anywhere that you would think would be you know, good for them to look at? So if I could just pass back to Leslie, that would be fantastic.
There are several websites available for male incontinence. One in particular that, as healthcare professionals, it's really worth going on to is the Prostate UK website. They have lots and lots of good resources, but not only for healthcare professionals, but for also patients as well. Really helpful hints and tips, but also resource documents that you can download. We are also doing a lot of activities on the World Continence Week on the Facebook community that we have. There's lots of resources on there that you'll find really helpful. And again, not only for healthcare professionals, but for patients as well, patients and their relatives. Also, there's the testicular cancer website. So Cancer UK, you can find an awful lot of information on there. But what I would, to be honest with you, as a healthcare professional, the easiest way to get lots of information, varied information, is to do a Google search on male incontinence, and you'd be amazed at the amount of sites that come up. Some of these sites patients have actually instigated themselves because they've shared their experiences.
Brilliant, thank you so much for that. No, that's fascinating, and I think it's as you just mentioned, it's important to add that with the Continence Week coming up in June, there'll be lots of fantastic events at Essity. We'll be doing some collaborative work again with Maeve, BCSS and the team, so very much looking forward to that. So for everyone to watch the space on that. We've then had an additional question. It's probably something I can answer. It was in relation to samples. We often get asked about samples. So yeah, if anybody wants to contact Maeve, if any clinicians want to get in touch with Maeve, I can sort that. I can liaise with Maeve and get everything arranged for you. We can get samples delivered directly to you. So feel free basically to ask at any time. And yeah, always open if anyone's interested in samples, so feel free to ask. So I'm actually, again, as I mentioned, conscious of time. So what I'm going to do, if it's okay, Leslie, absolutely fantastic. You've been brilliant as always. Thank you so much. And I'm going to pass over to Maeve to conclude the session. But just from an Essity perspective, a TENA perspective, thank you so much for joining us. And I hope you all have a nice afternoon. And I'll just pass back to Maeve. Thank you.
Okay, great. Thank you very much, Leslie. That was an excellent presentation today, incredibly informative. I'm sure you all got lots from it. And thank you, of course, to Ian for, as always, hosting our Q&A session. Just to say again, thank you to you for attending today's webinar. We really appreciate your time, and I know it would have been worthwhile, I'm sure. Please feel free to contact me if you have any follow-up questions regarding today's event, or any questions at all regarding the TENA range of products. I'd be delighted to be of help to you. You have my email address, and also my mobile is part of my email address. Also, just to let you know, we will be delivering our next webinar session in June, so just a short time away. So please watch this space because we'll be advertising that soon. Thank you and take care.